Hey, this is Doc Yates. I'm a naturopathic doctor, registered acupuncturist, and a kinesiologist, owner of the Yates Naturopathic Clinic, and the founder of the interactive health website, Able Health. And this is the Simply Health Podcast, a show for females where I work to simplify and demystify the secrets of achieving optimal health naturally, based on my own experience in working with thousands of female patients over the past 15 years of my clinical practice. Welcome to Simply Health. Hey, this is Doc Yates, and today we're going to talk about 6 critical components for treating UTIs in perimenopause and menopause. So typically speaking, there's not a lot of work done for this besides just giving you antibiotics either as needed or preventatively. And what I've been really working for with my clients is that how can we deal with this without having to use antibiotics, which is going to wipe out your normal flora, lead to digestive issues, lead to other bacterial imbalances and yeast problems. So let's go through these 6 points. Point number 1, especially in the perimenopausal demographic, we're looking at estrogen. When your estrogen levels get low and they start to drop, you will see an increase in incidence of bladder infections, UTIs. So you want to make sure that you're getting your estrogen balanced. And of course, as we've mentioned before, you don't really balance estrogen without balancing progesterone too. So getting your hormones balanced is extremely important. That's why it's point number 1. Point number 2 is that there's a lot of natural herbs that have antimicrobial effects or antibiotic effects that don't wipe out your normal flora. So it's always good to start with those first. Examples of anything with berberine, uva ursi, using things like nettle to help flush out, plantain to help flush things out. And then you can they'll add in something like marshmallow root to soothe everything. Start with those first, and if you don't see the response that you're looking for in about 3 days, then you don't want to risk getting into a kidney infection, then you can go with antibiotics. But if you start with those first, I always see things improve, so chances of you needing the antibiotics after are very low. Now, in other cases, for point number 3, when you're dealing with chronic interstitial cystitis, those are cases where they have chronic bladder infections, but yet when they're checking the urine and culture, they're not finding any bacteria as an issue anyways. In those cases, you still need to do the estrogen balance, but then and the hormone balance, but then you typically also need to look for food sensitivities. And I found when we put someone on a diet that reduces food sensitivities and inflammatory foods, balance their hormones, then you will see the improvement of the interstitial cystitis, which can be combined as a treatment in clinic with acupuncture, but we're going to get to that more in point number 6. Point number 4 is chronic yeast infections. So people with chronic yeast infections can lead to a lot of irritation around their urethra, and if that's the case, it can also lead to bladder issues. And that's where you see this recurrent issue is where someone gets a UTI, and then they're given antibiotics, but then they get a yeast infection, which leads to irritation around the area, but then they get more prone to more UTIs later because their healthy bacteria has all been wiped out. So to deal with chronic yeast infections, you'd still use herbs with berberine, but instead of just a food sensitivity diet, you really need to pull back on sugar. Again, in those cases, sometimes you're looking for is there a problem with excess estrogen. If estrogen is pushed really high, it can really increase the blood sugar content to the vaginal wall, making you more prone to yeast infections. So you want to make sure that you're getting hormones balanced. It's not just about taking hormones, it's about balancing hormones. So point number 4 was dealing with the yeast infections. Point number 5 is that, like most cases, you want to see is there a structural issue. And in these cases, the best thing you can do to assess that is to see a physiotherapist that focuses on pelvic floor issues. Dealing with pelvic floor is a lot more complex than just doing Kegel exercises. In fact, a lot of the pelvic floor therapists that I've spoken with have found that a lot of the times the issue is that there's too much tightness in the pelvic floor, and people keep doing Kegel exercises, but they're only increasing that tightness instead of doing them properly and making things worse. So if you've had kids, or if you're prone to, say, leaking or peeing your pants from jumping on the trampoline or running or jogging, jumping, laughing, giggling, sneezing, check out a pelvic floor physiotherapist in your area. And point number 6 is acupuncture. Acupuncture works great for people who get recurrent UTIs. It's one of those things when I first started in practice, I even as an acupuncturist, I was like, I'm not sure if this will be one of the mainstays of treatment, but it definitely is. It definitely probably fits on my top 10 list of things that respond well to acupuncture. So I would put bladder issues on that list. So check out an acupuncturist, or maybe you find someone, a combination therapist who does acupuncture and pelvic floor. That would be great, though pretty rare. But you can find out a lot more information about the acupuncture points. We will be posting that information and how to push on the pressure points in Able Health. Same thing for the food sensitivity diets and the diets for free diets for people who have problems with bladder issues, interstitial cystitis, chronic yeast. All that can be found on Able Health or Able Beta, depending on what phase of the development we're in right now. So I hope these 6 components were helpful. Because this is something that I see pretty often, and I see a very good response when you're finding the right combination of treatments, which also is nice because, like I said, it means you can treat all this without having to just jump right onto antibiotics every time you get a symptom, or even some cases, some people literally have to take antibiotics every time they have intercourse. You can just imagine the amount of antibiotics that's building up in your system and wiping out your flora. So again, I hope this was helpful. I hope you learned something. This is Doc Yates, and I'm signing off. Thanks for tuning in to Simply Health. If you want to learn more about health, check out Able Health. If you want to see some of the other projects that I've been working on in health, business, music, and life, please check out the links below.